G'day everyone, welcome back to the channel. So in today's video, I want to show you guys how to do a sciatic nerve flossing exercise. And for those who aren't aware, neural flossing exercises can be a really important piece of the puzzle to a whole range of musculoskeletal aches, pains and injuries. And in the context of this video, we're going to focus more on how to do the sciatic nerve version of that and show you how to add a few little tweaks at the end to bias different parts of your sort of the lower leg nerves, just to hopefully give you some context and some experience to try and free these sort of things up for yourselves. And again, for those who aren't aware, generally the sciatic nerve flossing exercise can be really useful for two things in particular. The first one is obviously low back pain. So if someone has low back pain, maybe you're getting some sciatic nerve type symptoms, maybe some pain down the back of your leg, maybe some pins and needles and numbness or some tingling or some burning into your feet. It can be really good to help tie in some of those symptoms and help those symptoms sort of go away. But one of the things I think gets missed a lot is hamstring dysfunction. And I've done a video on this before that I'll link up the top here, but I think clinically I find a really strong relationship between low back dysfunction and hamstring dysfunction, to the point where I would almost argue that nearly every single hamstring issue, whether it's hamstring tightness, tendonitis, a hamstring tear, hamstring strain, anything hamstring dysfunction related, is potentially a back issue first that expresses itself in the form of hamstring dysfunction, or at least the hamstring's the tissue that doesn't tolerate that low back dysfunction in the first place. And a connecting feature of that can often be this sciatic nerve, neural tightness. So being able to sort of free that nerve up and express more normal motion through the sciatic nerve can be really helpful for low back dysfunction and hamstring dysfunction specifically, and also calf dysfunction as well for a lot of people. So before we get to the exercise in a second, I just want to talk about a little bit about the neural flossing techniques, because I think that context is really important to make sure that you know how to do it properly, but also that you understand why you're doing it and why it's important to do this type of thing as opposed to regular stretching. And the main point I think that we need to get across here, excuse me, is that neural tissue, the nervous system, doesn't stretch in the same way that a muscular system does. For example, if you're trying to stretch your forearms or your calves, you can put that in a position where you feel a nice stretching sensation through that soft tissue. The nervous system is closely related, or more closely related, to a bunch of steel cabling as it is to like an elastic musculoskeletal system. So when we're trying to mobilize that tissue, when we're trying to improve the flexibility or the mobility of your nervous system more specifically in regards to the sciatic nerve, we can't think of stretching it. So stretches is technically the wrong word for neural mobility exercises. We're really trying to mobilize and floss that tissue free. So the reason why we do this is because the sciatic nerve in particular comes from the lower reaches of your lower back. Obviously, it goes through your butt cheeks and comes out down the back of your leg and goes down into your calf and branches off into all these different nerves, which we'll bias in a second when we do the stretch. But the important thing is you need to picture that nervous system as a piece of string or a piece of cabling running through and around a whole bunch of meat tunnels or soft tissue, connective tissue tunnels. And the best way to mobilize that is to get that to floss more freely, which is what it should be doing anyway. So you need to have enough mobility in that nervous system to express yourself normally. And as I said, when we're dealing with sciatic issues and hamstring issues, often we can see clinically that there are some neural tightness related issues that are compounding what's going on. So it's well worth checking out to see if this is affecting you in some way. So getting into the exercise, the main thing I think we need to do to begin with is we want to do a particular movement first, so that when we do the exercise, we then come back to this movement, we retest the movement so you can see genuinely what's changed on you, but also what's changed on me, so that you know exactly what this exercise does for you. You don't have to guess, you don't have to take my word for it. You don't have to be promised anything by your physiotherapist or your physical therapist or whoever's told you to do it. You can make some honest judgments in real time to know whether this is worthwhile and whether neural tightness through that sciatic nerve is contributing to your low back and hamstring dysfunction. So a really good movement to do if you're by yourself is to simply, to stand up nice and tall and just bend down as far as you feel comfortable with your legs straight. Now, I'm fortunate in a sense where I'm mobile enough where with my legs straight, I can get my palms flat on the ground. But just take a second to see where I am in space here, because when I do this stretch, hopefully you'll see me drop down a little bit further. And just an interesting sidebar, when you are bending down here, if you feel some tightness at the back of your knee, then that's sciatic nerve tightness. That's not hamstring tightness. General hamstring tightness should be felt somewhere in the muscle belly. But if you feel that, that tightness at the back of your knee, a common misconception is that it's a hamstring tightness. It's not. It's generally a sign that the sciatic nerve is tight or it's not flossing very well, which again would be a sign that your lower back isn't functioning correctly, that it might be stiff at the base of that spine somewhere. So just be aware of that, because if you notice that when you do this forward flexion test, take note of how it feels afterwards once we've done this exercise. So in order to do the stretch, basically all you need to do is we just want you to lie down on your back, have one leg out straight, have the other one sort of the hip flexed to 90 degrees, or basically where you feel your arms can comfortably support it. So what we want to do here basically is, the way that I like to do this is I'll get you to bend your foot back first, and then we're going to get you to gently just come up and down and oscillate up and down. So you want to basically imagine that obviously the nerve's coming all the way down here and into your back, and we're basically just trying to floss it throughout that sort of musculoskeletal system to hopefully get through any of the rusty bits or any adhesions or any tight restricted bits that might be stopping you from going further. So again, what I want you to do is keep that foot back, straighten that leg out as far as you feel comfortable, then just come in and out of that range. And what I get my patients to do is when you get up to the top, take note of where your toes get to in relation to the roof. Get a visual image there. Once you've done 10, 12, 15, 20 of these, what you'll hopefully see is that your foot actually starts to go further and further back. Your leg will get straighter and straighter without that foot bending. Some people like to do basically where they start flexed and then you come up into a pointed position. I just find personally that I can get faster results by keeping that foot tension backwards or bent backwards in dorsiflexion and allow that to free up. So again, just having done that, I think I've done sort of 15 to 20 of those. We'll come back to this again in a second. But the next thing I want to get you to do is just bend down again, see how far you can go. So this is where I was before. Now I feel like I can get down a fraction lower and bend my elbows a little bit more and have less tension behind the back of this left knee. I still feel some on the right leg. So what I'll do here is I'll just even that up. I'll just see if it changes again, which again I would expect it to. So again, for me, lifting this leg up, that's where I get to. I'm going to do 4 or 5 of these and it feels okay. So I'll keep going sort of 10, 15 or so. And again, taking note to see where my foot's going each time. You can hopefully see that even in the video, it's going back a little bit further as I talk. And I don't think I'm pulling my hip, my knee closer to my hip and sort of biasing that. I feel like I'm at my arm's comfortable length, and it feels like things are freeing up, and that shin and that foot are going further. So same thing again, doing this again, bending forwards. That's where I was before. Now I feel like I can get down even further again than I could before. So hopefully that shows in the video, but more importantly, if you do this yourself, you want to feel like there's a change straight away. Obviously, if you have some back pain, be careful doing that test. Even if you have some hamstring pain, please be careful as well. But just get a general sense of how far you go, do the sciatic nerve flossing exercise and come back again and do the same test again. You should feel like you start to go further straight away. And hopefully you see some of your symptoms feel a bit better as well. So the variation of this that I think is important to go through as well is sometimes if people have some perineal issues or some calf issues or even some tib post, some issues on the inside through here, even some tib ant dysfunction, sometimes that can be nerve related or at least have a neural connection beyond what a lot of people realize. So what you can do then is, depending on where you want to bias, so for me, if I wanted to bias the outside of my leg a little bit more, if that felt a little bit tight, I can turn the sole of my foot inwards to sort of open up that area, bias that tissue, and then what you'll find is when you do the same thing again, you'll feel a little bit more tightness around the outside. Again, if you're trying to get that tib ant area, if you point that toe, you'll feel some tension there, and keeping that tension on and off can be a really, really good way to free up some neural tightness at the front of that shin as well. Same thing as before. If you really want to target the inside, we can turn your foot outwards to open that up and then again, turning that foot outwards, and then we'll find that it might start to bias the inner part of that calf, the inner part of that shin a little bit more. And that might also help you figure out some of the hidden underlying causes of that dysfunction as well. So, just to summarize, the important thing is that if you have any back dysfunction, any hamstring dysfunction, it's good to at least try out this sciatic nerve flossing exercise. Remember, it's not a muscle in a sense where you should be stretching and tugging on that. We want to glide that tissue through its surrounding tissue to free up that tissue, which is it's how it should be normally. So, but don't take my word for it. Please do a test and a retest before and afterwards, so you can see exactly how much more flexible, how much more mobility you get from this exercise, and hopefully that ties into some of your sciatic pain, low back pain, hamstring stuff. Again, even calf stuff, lower leg muscular dysfunction. There's even a potentially made a case that some plantar fasciitis and that sort of stuff is connected to some excess neural tension. If you have it, give it a go, see how it makes you feel. So as always, if you have any questions, please leave them down below. If you found this useful and you found this sort of helpful in some way, please let me know in the comments, and please leave a like rating down below just so that I can see that things are going well for you guys. And if you enjoy this type of content, as always, please subscribe to the channel, follow along. I'm always looking for new ideas and some new concepts to get out there, so please let me know in the comments if there's something specific that you want me to target. But also, I really hope that this channel can grow into something special. And obviously, the more you guys can follow along, then the greater the opportunity that'll be to happen. So, so again, hopefully that was helpful. And I guess I'll see you in the next one.